In 2010, when I saw an ad in the paper that a free clinic was beginning in Statesboro, started by a group of university students, it just really piqued my interest. I'd been looking for a place to volunteer within a medical setting just because I'd always enjoyed that setting, and I'd had a previous position where I worked with children with disabilities. I was raised in a family that always did volunteer work, and I've volunteered at my church for many, many years. This is just a different avenue than I've ever volunteered in before. But because this is my own community and because I see the need here, it was just an easy thing to do. And I love to help people, and I especially like to help advocate for people that can't do that for themselves. So I thought I would have a chance maybe to combine all of those interests in this volunteer position. I've been the medical clinic coordinator for, I think, about 3 years. I think the first maybe 3 to 6 months, I just was basically the intake coordinator. I guess I work probably about 15 hours a week here at the clinic, and then I work from home because it's very easy to make phone calls from home. This is a wonderful community that we live in, and once the providers are here and they see what a wonderful place it is, you know, they're more than willing to give back. So I'm rarely turned down when I ask someone to volunteer, and it's really not that difficult to do. It's really a pleasure to be able to ask someone if they would do that, and it's very exciting when they say yes. Our patients, you know, very often they've worked all their lives at low-paying jobs with no benefits. It's very difficult, even though people think it's easy to get government assistance. It's really not. Sometimes our very ill, sickest patients, you know, are unable to receive those benefits. So the clinic just means so much to so many people in our community. A lot of what I do is linking patients up with community services. I do all the referrals to specialty care physicians. The other thing that I do is I oversee our women's clinic, and that's a monthly clinic that we have separate from our medical clinic. You know, in the beginning for this clinic, we had no vision of having anything different other than just the primary care for patients on Tuesday night. But I just saw the great need for the women to have their own clinic, you know, the privacy and just for them with primarily nurse practitioners.
My name is Jordan Wilburn. I'm the director of the Hearts and Hands Clinic in Statesboro, Georgia, and I nominated Ann Clifton for this award because she truly is the heartbeat of Hearts and Hands Clinic. She is our local connection, someone who cares so deeply for this community and the people who are here, and who can bring in this whole piece of collaboration with our local physicians, our local community members who care and have resources, and of course our patients. She really connects all of the dots that we need help connecting.
A former patient was here at the clinic, and he said, "Before I leave, I need to speak to you for a minute, Miss Ann." And I said, "Okay." So when he got through with what he was here for, he brought to me a very tightly folded bill and slipped it into my hand. And I opened it up, and it was a $100 bill. And I just was overwhelmed because he had just received, I believe, disability benefits a couple of weeks earlier. And he'd always said, when I get some income, I'm gonna do something for you all. So that was just amazing to me. He said, "Please use these to help somebody else as much as you've helped me."
I found out about the Hearts and Hands by reading the paper, and they've been wonderful. Miss Clifton have worked with me and my sister to get all the help that we need. And so my diabetes have gotten to mostly where it should be, and they're still working to get it where it should be. And Miss Clifton gonna see that it gets where it needs to be. She's a very special person, and I love her. Yes, I do.
Well, I thought about what it means to be the heartbeat of an organization, and I guess the heart keeps the whole body going. So I guess that means that I want to see the clinic go on and on and on. And I do whatever it takes to make sure that nothing happens to it. You know, I do fundraising, I I ask for money from different organizations that I'm aware of, you know, and I'm very outspoken in the community about what we do, and so that's one aspect of my job. But I think our logo, you know, using our hearts and hands to give people hope, that's really what inspires me to do what I do, because our patients often don't have any hope. I mean, they have no hope of getting medical care, dental care, vision care, and it's just a blessing to me to be able to be a part of giving someone hope, because without hope, what do you have?